got Dr. Karolyn Surmont here. Actually, very recently, I met her through some miraculous circumstance of a Facebook ad. And Dr. Carolyn, I've already told you that you came into my life at a time when I was just really, I felt like I was running at the bottom of the bucket, energetically, and just everything that was not going well in my body and my physical being. And you helped straighten me up in just a matter of about 6 weeks. And so I'm really grateful for that. And I'm super grateful that you are who you are in the world, and your heart for empowering mothers and using your chiropractic practice as not just a way to help get bodies aligned, but to help with a lot more than that. So I'm looking forward to what opens up as a result of this.
Well, thank you. I'm absolutely delighted to be here and to help other moms on their journey to be the best moms they can be. That's what I'm all about.
I mean, you can speak from the perspective of a mother because you were a mom of 5 boys, right?
Yes, that's correct.
How long have you been a chiropractor again?
It's only been a few years. Actually, it was being disempowered as a mom that led me to becoming a chiropractor to empower myself and take care of my child's health. And that's what led me to all of this, and why now I'm really on this mission to help empower moms to be the best moms they can be.
Do you want to share your story? Just kind of where you were, because you were a teacher before you became a chiropractor.
I was. As you said, Holly, I have 5 children and 5 boys. They're very close together. Absolutely love being a mom. And when my oldest child turned 18, he was electrocuted in a fluke work accident that sent us down a journey that I don't wish on anyone. So he was rushed to the hospital. He flatlined in front of us, kept in the ER or in the cardiac ICU overnight. He was released and told he was fine. The challenge was he wasn't fine. And it took us a long time to figure that out. He had been a multi-sport varsity athlete, so tip-top physical shape. But when he got out of the hospital 2 days after the accident, he could not, he just didn't feel right. He couldn't lift a broom. He couldn't do the normal things that he could do. So we took him back to cardiologist, and they said he's fine. Just give him some time. He'll recover. It's just a traumatic, incident that he went through. So he went to college in the fall, but then within a short time, he was letting us know that he was having a hard time walking a half mile from the parking lot to the classroom. So we took him back to doctors who gave us the same answer. Give him time. He'll be fine. So the next semester, he started taking the elevator instead of the stairs because he couldn't walk up a single flight of stairs. Led us to more doctors with the same answer. Give him time. He'll be fine. But time was making him worse, not making him better. It took about 18 months before we got a diagnosis of dysautonomia, which was the first indication we had that his accident actually didn't cause heart damage. It caused a traumatic brain injury. So that started us down a whole new path of doctors. And we went to the best of the best all across the country and tried every single protocol that they recommended. He was on different medications. He wore special clothing. He had a special diet. He put his bed in an unusual position. If they recommended it, we tried it. And he kept getting worse and not getting better. And ultimately, over the course of about 9 years, he kept going further and further downhill. And not only did he lose physical ability, he lost cognitive ability. And then he started losing, having sensory processing issues. So he couldn't go out where there was a lot of sensory input. It would send him into what we called pseudo seizures. The pseudo seizures were similar to a grand mal seizure, where he'd go into a tonic-clonic position. But instead of lasting 2 or 3 minutes, these would last 2 or 3 hours. And he would remember everything. So they were devastating for him. And it could take him a month or 2 to recover from one of these pseudo seizures. Ultimately, every single doctor that we went to washed his hands of my son's case and said, sorry, sucks to be you. This is who he is. There's nothing we can do. But Holly, you see, I'm a mom, and that was not a good enough answer. I felt very much that I had been disempowered. Like, I can only do what you tell me I can do. So, to take that power back as a mom, I started doing some research, which led me to chiropractic. I was aware of chiropractic, but I was aware of it from a pain based kind of situation. And what I came to know is that chiropractic is much more than that. It's very neurological. So I sold my house, moved across the country, and studied to become a chiropractor. And everything that I studied along the way was all about how can I help my child. And at the 9-year mark, my son came to me and said, Mom, I'm done with this. My friends are getting married and they're having kids, and I'm sitting on a couch doing nothing. He couldn't walk up a flight of stairs. He couldn't carry anything. He couldn't lift anything. He had so many problems, including a lot of symptoms for your moms out there who are familiar with this of POTS, which is a postural orthostatic tachycardia syndrome. So he would go from sit to stand or from laying down to sit, and his heart rate would go from a normal 60 beats per minute to 200 beats, and he'd be pounding out of his chest, and he'd have pain and all kinds of things. So at 9 years, he came and said, I'm done, Mom. I want to get better. Tell me what to do. So at that point, I was far enough into my chiropractic education that we put him on a protocol. And it was very, very slow going. And it was very much based on what was his goal. His goal was to run a mile like he did in high school. Now, he had been an athlete, as I said. He had played soccer and run track. And so he knew what it was to run. And he wanted to run again. And at that point, he was walking so slowly that the first day he went out to just work on that, and it took him 30 minutes to walk half a mile. So that is incredibly slowly. For most of us, we have a hard time staying back that slowly. We get ahead and we have to stop and wait, let you catch up, and then do a little bit more. And it's very hard to do. But that was as fast as he could go. So we put him on a protocol of exercise and then slowly added other modalities so as not to overstress his nervous system. So we added over time chiropractic care, functional neurology, cold laser therapy, nutrition therapy, and then some mindset work to help him create positive thoughts to create a positive reality. And day by day and week by week, we did not see many changes at all in him. But month by month, we began to see that, oh my gosh, he's doing this better than he did last month. And he's starting to be able to play a game with us instead of sitting back because the sensory processing issues were not so extreme. And exactly a year later, on the 10th anniversary of his injury, he ran his mile in under 6 minutes. And that was just huge, from being able to walk half a mile in 30 minutes to suddenly being able to run a mile in under 6 was huge. But I'll tell you, Holly, he wasn't healed at that point. It took him 2 months to recover from that run. And he continued working, continued exercising. We continued on the modalities. It took a total of about 4 years before he was, he will tell you that he's fully healed. And praise God, the great news is that he has gotten so much better that he now himself is a chiropractor as well. He graduated about 6 months ago and is working as a chiropractor as well. So my experience really of being disempowered by Western medicine led me to really take control of my own education, my own situation, so that I could be empowered as a mom and offer the care that my son needed. And through that experience is what's led me to being a prenatal and pediatric chiropractor now, neurologically based, so that I can take care of other kids who have similar issues that my son had, and which has also led me to this goal of helping to empower moms to really be the moms they're called to be.
What a story. And 10 years is a really long time.
It is.
To be enduring, not only from your son's perspective, but from a mother's perspective, because he's not your only child. Even if he was your only child, this would still be a lot to handle. But you have four other babies at home as well.
Well, remember that he was 18 when it happened, and
Oh,
so
that's right.
he was
Okay.
18, and the youngest, I think, was 12. There's about 6 years between the oldest and youngest, and so they were, to a large degree, they were self-sufficient at that point. They
Okay. Okay.
in high school, they were doing different things, and so yeah, we were able to manage, but it was a lot of work, and a lot of things for them kind of fell through the cracks because we were working so hard to take care of him.
Yeah. Let's go back to the your disempowerment around the Western medicine. And we hear this often. Doctors just try to figure out a cure, try to figure out some sort of something in hopes that it will work. Some doctors think that it will work, some doctors don't know. But you heard time and time again, just give him time, just give him time. And each time you gave him time, his condition seemed to get worse. How often is it the case now in your professional record? How often is this the case that doctors are just like, oh, just give it time, and then it actually gets worse over time?
Well, it's interesting that you asked that, because give him time, he'll be fine. There is some truth to that, in that all processes take time. So healing takes time. And in chiropractic, there's 33 principles. Principle number 6 is all healing takes time. So we're constantly telling our patients the same thing: give it time. But we can't give it time and do nothing. We have to give it time and do something. And what was disempowering to me, what the doctors, when they were saying, give him time, he'll be fine, what I began to realize is they weren't really saying anything other than, go away. I have no idea how to take care of him. Really, I have no idea what to do. So just go away, give it time. Let's hope it'll get better. But it didn't for him, because he wasn't getting what he needed. Now, in a lot of cases, give him time, he'll be fine, is absolutely accurate. And let me give you a quick example that will help empower some moms. Okay. So think about a toddler getting an ear infection. You hear about ear infections in toddlers all the time, right? So if you go running to the doctor with an ear infection, the doctor is likely going to give your child an antibiotic. And the child will feel better and will begin to heal as that antibiotic fights off the bacteria that's causing the ear infection. And in about 10 days, your child will be all well. That's great. If you do nothing and give it time, that ear infection will likely heal all on its own in about a week and a half.
Same amount of time.
Same amount of time. Now, what's the difference? One, your child's going to feel better right away, because the antibiotic's going to take care of that bacteria and bring down the fever a little bit, and they're going to feel better. But at the same time, that antibiotic kills both bad and good bacteria. So now the gut flora that's so important for digestion gets killed. And research has shown that it takes 2 years to regrow gut flora once it's been killed by one round of antibiotics. So the question is, in empowering moms, can you put up with and manage a child's discomfort and potential fever and pain in the ear for a few days and allow the body to heal the way it's designed? The fever is important because it creates an environment where the bacteria doesn't like it, and it tends to kill off that bacteria and make it go away. So the fever is an important part of that. They may be uncomfortable. You might have to give them a cool bath. They may be whiny for a few days, but in 10 days, when they're healed, they've got an intact gut flora. Now they aren't ending up with more problems.
So why are we, I mean, it's been ingrained in me, and I grew up in the 80s. I was born in 84. It's why do we have this, like, for me, it's like a little danger sensor inside that says if a baby has a temperature of 102 or 100, 101, 102, I think really you take them to the emergency room.
You know what? I think that a lot of that has to do with when the Western medicine used to be a service that was patient-centered. And the doctors were focused on, how do I best take care of my patient? In the last several generations, Western medicine has become an industry. The doctors don't work for the patients anymore. They work for the hospital or the insurance company who's paying their bill. And the reality is that, yes, the antibiotic, it works. And no doubt it works. But we've so overused them that now we're ending up with superbugs. And so antibiotics don't work as well. But what's happened is the doctors are being controlled by the insurance companies, which are being controlled by the pharmaceutical industry, which is saying this is the protocol for this situation. And if you deviate from the accepted protocol, then you open yourself to medical malpractice lawsuit. So even when doctors want to say, go home and do nothing, the fear of a lawsuit says, no, I have to prescribe. So now, and so everybody across the board does it. But what they've done is they've stopped moms from saying, hey, I can manage this. They've created this fear of 101 or 102. The reality is, when my children were little, I was comfortable up to about 104.5. At that point, I would take them to the ER or to the doctor. But I understood, even before I had studied medicine and chiropractic, I understood that a fever was a good thing because it was creating an environment that bacteria doesn't like, and it's going to kill it off. So let the fever go, keep them comfortable, and they will get well. And I tell you that I rarely had to take my children. Yes, they got sick. Yes, they had a few ear infections. No, we didn't go after the antibiotics and the medications. We let it run. And I have 5 absolutely beautiful, healthy young men now, 3 of whom are chiropractors and 2 of whom are great in business, and everybody's healthy. And that's really the goal. And I think what happened was, because people ran to the doctors and doctors gave solutions and said, oh, just trust me, do what I tell you, they created an environment where people just did whatever the doctor told them to, without really considering, is that the right thing for me or for my child? And because they created that idea over several generations, now people are just too afraid to make the choices by themselves.
So you said that you were comfortable with like 104.5.
Yep.
Are you saying that
I would not say that
101, 102 degree fever is not dangerous and you don't have to go to the hospital?
I would say that you don't want it to be extended. And please don't take this as medical advice. You need to make a decision. Each mom needs to make a decision for herself in any particular situation. For some people, 104, and it depends on the age. I'm talking about, a younger child and a shorter fever. Okay, I wouldn't leave it there. If my child had a fever of 100,
what would you consider like a shorter, like 2 days, 3 days?
Even if they had a fever of 104, I would be putting them in a cool bath to cool them down externally. I would not be using medication. I would be using cool compresses. I would give them something cool to drink. I would help keep them comfortable, but I would work to pull that down in a more natural way without giving them medications to do so. I would monitor it. And if it stayed high for any length of time, then I would go to medications, and only after a period of time would I take it. And it's one of those things, Holly, it's hard to say. It's hard to say because each situation is different. You have to look at how lethargic is the child, because you can have a child who has a fever of 102 that is laughing and playing. If they're laughing and playing at 102, then let them laugh and play at 102. If they're completely lethargic and you can't wake them or can't lift them, no, you need to get help for sure. So it's not just a what's the fever, it's what's the fever and what is their demeanor. And so that's where, as moms, we need to look at it and say, okay, what do I do? What's the appropriate thing to do in this situation? It might be going to the doctor, but it might be, let's give them a cool bath. Let's make sure, that they're comfortable and give them time to get through that process. I'm not saying it's okay to let your child have a fever of 104.5.
Yeah.
I'm saying if your child has a fever of 104.5, use your common sense to say, is this coming up? Can we bring it right back down? Is my child really sick and do I need to take them in? I'm not saying keep them home absolutely at 104.5 and take them in absolutely at 105. I don't want anybody to take that out of context. Likewise, a fever of 100 or 101 that persists for a long period of time that they're not getting resolution from, that also needs to be seen. So,
what would you say is a long period of time?
Several days where it's consistent and it doesn't come down. So I think that it's important to understand that when, for example, a viral infection might cause a really high fever, whereas a bacterial infection might cause a lower fever. But if your body's not fighting it off and it persists for several days and doesn't come down, work on it. See what else is going on in your life or in your child's life. Do we need some assistance, or can we manage this for a few more days? And so you have to use your common sense. Try the cool bath. If it stays there, then you need some help. If it's coming down and then coming back up, then look at a lot of different things to say, what's in my diet? What's my exercise? Am I getting enough fluid? What do I need to do to get over this?
And what do you think? What do you think about Tylenol? Is that helpful, or do you think that that's kind of like a mask that kind of gets in the way of being able to assess what's really going on?
I think in a lot of cases, Tylenol is a mask that's used that masks the symptoms so you don't realize that you're sick, but also it can prevent you from having the fever that you need to have. So don't jump on the Tylenol right away. Sometimes you need to have that, the fever, in order to get rid of the virus or bacteria, right? And if we take it too soon, we're prolonging the illness. On the other hand, there are times, particularly for pain, that we just need to get out of pain for a little while so that the stress of the pain isn't what's preventing us from getting healthy. So sometimes we need to take some sort of pain reliever in order to reduce the amount of pain so that we can just relax for a bit and begin the healing process. So I'm not opposed to it. I don't personally take it. I think that there's not enough education about, people don't understand that there's a maximum number of lifetime doses. So people who take Tylenol once or twice a day, every day for an entire year, maximum dose for an adult is 1,000 doses in a lifetime. Well, think about that. If you take Tylenol once a day, every day, in 3.5 years, you've maxed out your lifetime dosage. If you keep taking it, you risk damage to your liver. So, and people don't know that. That's not made widely known, but it is known that there's a lifetime dosage for virtually every medication that's out there. So people have to be careful.
Mm-hmm. Okay. I want to go back again to the doctors and Western medicine practice. I feel like we are in this state in our culture and in our country that I feel like everybody is being demonized somehow. And so I want to make sure that I want to get really clear, and I want our listeners to be able to get clear from themselves. Not all Western medical doctors are, bad, right? They don't have malintent. Why do you think it is that they didn't ever suggest chiropractic care?
So let me go back a little bit to something you said before I answer that question. I absolutely agree. There is a place for Western medicine. Western medicine doctors are absolutely needed, and they are critical in certain situations. I know that I would not be alive today if it weren't for Western medicine. And so I give them a lot of credit. They are wonderful in an emergency situation. They are wonderful when we've got something massive going on and we need critical care right now. But what I would say is that Western medicine has gone, if you look at health from the perspective of, if I have a fire in my house, I need the fire department, right? But once the fire is out, I need a construction company, not the fire department. People are using doctors and the medical industry for everything as though it's a fire. And So Western medicine has been to some degree demonized. I would agree, because and especially when we look at what's happened with COVID, with all the bad protocols that have been put out there, people are beginning to doubt their doctors now because they're following protocols. But we absolutely do need doctors. And what I would say in regard to why they don't recommend chiropractic, again, goes back to the whole pharmaceutical thing, right? Chiropractic doesn't allow the pharmaceutical companies to make any money. Pharmaceutical companies are all about the bottom line. If you look at who their stakeholders are, the stakeholders for pharmaceutical companies are not the patient. It's the people who own stock in their companies. So they're all about the bottom line. It has nothing to do with the patient. And so doctors are not going to recommend chiropractic care in many cases. Now, I will grant you, there are many who do, but the majority will not, for two reasons. One, they don't know what we do. And two, we tend to go after what's the cause of the problem, not just the symptom. And because we're going after the cause and now a person actually gets healthy, now they don't need as much medical care. And so again, it's the bottom line. But I think the bigger thing is many, many medical doctors are not exposed to chiropractic and they don't have a clue what we do. And so the not knowing stops the referral.
So chiropractic care kind of falls into the same category, or maybe the lost book of botanicals and natural herbal remedies and things like that, right?
Many of the old wives' tales about what the community doctor used to do, the herbalist, the naturopath, what they used to do, the medicine woman, right? Many of those old wives' tales are actually very good and very true, but they've been poo-pooed. And so they've been let go. But yes, essential oils, botanicals, naturopathy, all of those have a place and have really good merit. Now, in an emergency situation, we still need Western medicine. We need people who know how to do the surgeries, who know how to stop the bleeding, who know how to help you breathe when you can't. All of those things are very, very important. And I will not knock the medical world from that perspective at all. Where I come from is when the medical world disempowers moms from making decisions that they should be able to make, where they can take care of their kids without running to the doctor every other week.
Thank you for listening. And hey, if you heard anything educational, inspirational, or encouraging today, and you want more people to have the opportunity to hear it as well, please make sure that you subscribe, rate and review, and share. And as always, thank you for your support and for being the change that you want to see in the world.